It is our pleasure to be joined by Mark Crowther, MD from McMaster University in Hamilton, Ontario. Thanks for coming south of the border and joining us.
Thank you very much. It's a pleasure to be here in New Orleans.
Let's talk about this phase 2 study that you've presented data for here.
Right, so the study looks at the use of a new medication designed to reverse the effect of some of the new anticoagulant agents. Over the last 10 years, there's been a lot of work done to design and implement new blood thinning medications for patients, and one of the limitations that's been observed is that there's no effective way of reversing them. This new product is designed to specifically reverse the effects of the blood thinning drugs. Patients who are bleeding or patients who need surgical procedures can receive these medications, and when they receive them, it increases their risk of bleeding. This drug is designed to counter that effect and to completely stop the blood thinning effect.
How did you design this study?
The medication was designed by a company called Portola. The product is called Andexanet Alpha, and it's designed using our knowledge of how the blood clotting system works. It takes a molecule called factor 10, it's changed it chemically, and that chemically changed factor 10 molecule is able to bind to and inactivate these new blood thinning medications.
Mark, what do you think the key findings are of this?
The key findings are that this medication is able to almost instantaneously and almost completely reverse the blood thinning effect of these drugs. We do find patients come in bleeding on these medications, on these new blood thinners, and by using this medication, we hope to be able to completely stop that component of the bleeding that is due to the blood thinning medication through the infusion of this new product.
What are your observations on using this for future patient treatment?
We will need to develop a program for implementing this in bleeding patients. Bleeding patients can come into the hospital at any time of the day or night, and this is the kind of medication that when it's shown to be effective in all possible kinds of patients, that we hope to have available in emergency departments so that the bleeding patient can receive it promptly and have their bleeding effect completely reversed quickly and efficiently.
You really feel like you're onto something unique here.
This is a unique product. At present, there is no effective way of reversing these medications. The medications that we're reversing are widely used in medical practice in the United States and elsewhere in the world, and today there is no effective way of reversing their effect.
Very good. Thanks for joining us, and best of luck going forward.
Thank you very much.
Very good.